Hi, I'm Jeff Jones. I practice in Houston at the Baylor College of Medicine, and I've been treating patients with HIFU for over 20 years now. I think Sonablate offers the best in terms of therapeutic outcome as well as safety for the patients. It is especially important for patients that are being treated in an academic setting where you're teaching younger surgeons how to operate the HIFU equipment, because it gives that extra margin of safety that is not found in other HIFU delivery systems. Well, in terms of outcomes, I think all men want their cancer controlled as the #1 priority. However, they also want a good quality of life after their treatment. And this is where I think HIFU offers something that you can't get with other therapeutic modalities like radiation and surgery, because we know that a substantial number of these men will have side effects of therapy. And I think the side effects from HIFU are much less than those with either radiation therapy or surgery. Well, as I mentioned before, I've been treating men with HIFU for over 20 years, and I've done at this point hundreds of cases. And with that, as time has passed, we've gotten better with our technique, and we've expanded our indication for patients that want to have HIFU as their treatment modality to include those that would otherwise not be qualified just based on guidelines alone. Well, if patients just learned they have prostate cancer, they need to consider all the therapeutic options. And depending on their disease, how much volume of disease, what the grade of their cancer is, whether it's low, intermediate, or high-risk disease, they need to have the appropriate therapy for their actual disease state. And we continue to offer men that have low-risk disease active surveillance, and that's an appropriate management for those men. For those men that have intermediate risk disease, many times they're on the fence, especially if it's favorable intermediate risk disease. They don't know if they should do active surveillance or they should do therapy. Well, I think HIFU offers them a chance to get treatment to relieve their anxiety about having cancer without experiencing the significant side effects that you have from, say, a radical prostatectomy or radiation therapy. So I think for those men, primary HIFU is appropriate. Now, for those that have high-risk disease, most of the time, if there are suitable candidates, radical prostatectomy and pelvic lymph node dissection is the best option. Well, I think that you need to take care of your prostate. There's things you can do to keep your prostate healthy in real time each and every day. However, you should also have annual screening, and that includes a PSA test and a digital rectal exam if available. And with the PSA test, we should track the trend, and we can even use isoforms of PSA to determine if a man's at risk for developing prostate cancer. And with that, if they do have an abnormality in their PSA, then we should offer them prostate biopsy or at least an MRI to determine if there's a lesion there that looks like it might be prostate cancer. And from there, we can determine what's the best way to diagnose their cancer and the best way to treat it. So please, get your prostate screened regularly and diagnose it early when it's most likely to be cured. Well, when we're talking about a disease like prostate cancer, it's not universal on how quickly it will progress. Some men can have prostate cancer for many years and live with their disease. Others develop a rapidly metastatic and accelerated course depending on the risk status of their disease, which we usually determine by histology. So for our veterans that have prostate cancer and may be elderly or at least have advanced age, We don't want their final years to be suffering from a lot of side effects, and HIFU offers them therapy to keep their disease under control without experiencing the same potential side effects that radiation or surgery have. Okay, well, a patient typically with an elevated PSA or abnormal PHI or 4K or some indicator that they might have prostate cancer, we're going to get a multiparametric MRI. Based on that, the radiologist will annotate the lesions. If there's a region of interest, we will use that to selectively biopsy the patient along with templated biopsies to determine their total disease state. And based on that, we can recommend either active surveillance or treatment. And the treatment could be radical prostatectomy, it could be radiation therapy, or it could be HIFU. And if a patient chooses HIFU, we will schedule the procedure and ask them to do a bowel prep and eliminate any fecal matter from the rectal region. And we typically give a single dose of antibiotics at the time of the surgical procedure, and we insert the probe in the rectum and we deliver the energy after we have fused the MRI images with the ultrasound of the HIFU. And with that, we can target the lesion for focal therapy, or we can do a hemiablation or a whole gland treatment. We have placed a urinary catheter right before surgery. We leave that in place during the treatment unless they have disease in the anterior prostate, and we have to remove the catheter to get access to that disease. But most of the time we treat with the catheter in place, and we leave that there for about 7 to 10 days after treatment to allow the swelling to go down, at which point that we remove the catheter. The vast majority of our patients are treated as outpatients as opposed to inpatient treatment. Well, in two ways. One, if a man has disease where we have recommended therapy, HIFU offers an option for treatment that has less likelihood of significant side effects. So that's one way the fear is reduced. The second way is if a man has intermediate risk disease, but it's favorable, and they're on the fence between active surveillance and treatment, it offers a treatment modality that kind of gets over that PSA anxiety, because their PSA will drop with the treatment. And so they have some relaxation that their disease has been treated, unlike active surveillance, where they're often anxious about what the next PSA will show, or the next MRI will show, or the next biopsy will show. Well, focal therapy limits the treatment to where the disease is located and does not affect the bladder, urethra, and surrounding tissues the same way that radiation and radical prostatectomy do. Now, in many patients, those are appropriate modalities because they have high-risk disease, or they have disease that's already outside the prostate. And so you need something that's going to encompass the entire burden of disease. And the radical surgery and the radiation can do that better than HIFU. But for the men that have disease confined to the prostate, having a focal treatment reduces the effects of the treatment on the surrounding structures. And mainly we're talking about the bladder, the urethra, and the nerves that are involved with erectile function. Well, a hemiablation allows you to treat an entire lobe of the prostate that may have multifocal disease on biopsy without affecting the other lobe, and therefore the risk of side effects is much lower than a whole gland treatment or a radical treatment with either radiation or surgery. So limiting your treatment to half the gland reduces the side effects. At the same time, it allows multifocal disease to be comprehensively treated. Most of the time in our practice, the men that have high-risk disease, we recommend either radical prostatectomy or radiation therapy. That's the standard of care. However, if a man has high-risk disease and is not a good candidate for surgery, or not a good candidate for radiation therapy because of prior surgery and loops of bowel near the prostate, or because of comorbidities, then we could offer HIFU as long as the disease can be effectively treated. And typically that's a man that has a high Gleason score, but the disease is confined to a kind of a small area of the prostate. And I think for those particular patients, even they have high-risk disease, they can be effectively controlled with a focal treatment like HIFU. Well, large prostates give us a couple of challenges. One is if you have a lot of disease in the gland, scattered throughout the gland, and you have a large prostate, it means you have a lot of tissue to treat, and there can be a lot of edema during the course of treatment that swells the prostate and does not allow you to have a full therapeutic delivery of the energy, because as the swelling increases, you have difficulty in getting the entire gland treated. But the most important reason why large glands are a challenge is because we can only treat disease 4 centimeters from the rectal wall based on the technology currently available. And if you have a gland that's higher, taller than 4 centimeters, you can't reach that disease in the anterior part of the gland, in that anterior fibromuscular stroma, or more likely in the anterior horns of the peripheral zone. You can't reach them if the gland is larger than 4 centimeters in height. And so that's been our biggest limitation for using focal therapy in men with big glands.
Thank you.